Hi, and welcome to Office Hours, where I answer your questions about weight and weight medicine. I'm Dr. Meghan. I'm a board certified physician in internal medicine, lifestyle medicine, and obesity medicine. And this is really important because I actually prescribe these medications all the time. I actually talk to patients about their weight all the time. I've helped hundreds of patients lose weight, and I'm here to help you too. So if you're confused about your weight, and if you have questions about weight medication, and if you want medically based answers to your weight questions, you are in the right place. Welcome. So today I'm doing another episode of Office Hours, and let's just get started. And as always, as a disclaimer, I can't answer personal medical questions because I'm not your personal doctor, but if your question does lean a little personal, I'm going to change it a little bit so it's more broadly educationally applicable. So let's get started. First question, I'm up to 15 milligrams. Okay, this person is on tirzepatide. I'm up to 15 milligrams, not losing weight, started June, lost 25 pounds. I think that is a slow 1 to 3 pounds a month. Nothing in the last 2 months that's going up to 15 milligrams. Any suggestions? I do take thyroid medication and some other issues, insulin resistance, AFib, etc. How much is your consultation? Thanks. Okay, bunch of questions there. So let's start one at a time. So, I think this is a really interesting way that you phrased it because I'm up to 15 milligrams, not losing weight, started in June, lost 25. Okay, so you definitely lost weight. I think the question is really now you're not continuing to lose weight. So if I have a patient and they've gone up to the maximum medication, the maximum dose of the Zepbound or the Wegovy, and their weight has slowed down, that's when I will take a step back and say, okay, is this the expected new normal for this person? I don't like to call it a plateau because it's not a plateau. I mean, eventually everybody's going to stop losing weight on these medications because you reach your new normal. I like to think of it as a new normal, the new place where your body's comfortable at with the assistance of these medications. So I think a plateau implies that like something's gone wrong or something's stalled. So this is where I will sit back and think, okay, is this the new normal that I would expect for this patient? And on something like Zepbound, I'm anticipating about 15 to 20% of their total body weight. So if that's the case and their weight loss trajectory, their weight loss speed has really slowed down and pretty much stopped, and it lines up with where it seems like they should be, it probably, for me, I'm going to think this is probably as far as the medication is going to get you. And then if we want to take your BMI lower than that, if we feel like that's a safer, next step for you, then we have to think about adding something. We have to think about changing something with the patient's lifestyle. I have to think about maybe I want to add another medication. Maybe I want to add an oral medication for them. So that is really the next step is if my patient's weight has slowed down, are they where I would expect them to be in terms of total body weight lost on this medication? And second part is, if not, is there anything else that could be interfering with that? What else has changed since they started this medication? So then I'm thinking about if they are not where I would expect them to be in terms of total body weight loss, then I have to think about, okay, what else is going on here? Is there something else at play? Are there some sort of external circumstances that are interfering with the weight loss? Did they start another medication with another doctor? Did they go up on that medication? Did they change their eating habits? Is there a very stressful life event that's going on that's really disrupted things for them? Did their workouts change? There's so many different things that can interfere. So that's the next step that I'm going to look into. And then there are some medical conditions that we know are going to interfere with the overall weight loss prognosis for people. And so diabetes is a great example. Patients with diabetes, we know they probably aren't going to lose quite as much weight on a medication as somebody who doesn't have diabetes. So that's something to think about as well. The next part of the question is, how much is your consultation? Okay, so some of you might not know this, some of you do. So I work as a physician, but I also work as a life coach. So I help people around the world with the non-medical aspects of their weight loss as well. And if you want to work with me, I'll leave that link below. The consultation is completely free. Really, we just talk about if this is going to be a good fit for you, what you're looking for, what's been going on with somebody. It's not a medical consultation. It's for coaching on the non-medical aspects. As you all know, there are so many issues that go on with weight loss that have absolutely nothing to do with the medical conditions that somebody has. So if you're interested in that, I'll leave the link below. And thank you so much. Next question, please tell us how soon you would feel comfortable prescribing GLP-1s after weight loss surgery. For example, after a sleeve for a patient with a very high BMI. Such a good question. Okay, so you guys all have really good questions. I really enjoy these videos. The questions that you all ask are very sophisticated and interesting, and I think so helpful for everybody. So for somebody who's had a gastric sleeve or gastric bypass surgery, I will really, so part of this, part of it is the bariatric surgeon is going to, monitor the patient for a long time. And then the obesity medicine physician is either, sometimes they work in the clinic with them, and so they're working in tandem, or they're picking up where the bariatric surgeon left off once the surgeon feels like, okay, their work is done, they're past the point of needing to be monitored from a surgical standpoint anymore, and that's where the obesity medicine doctor will pick up. For me, of course, I don't want to step on the bariatric surgeon's toes. So there is that interval where they are going to be monitoring them. And so whether they choose to have a patient on or not on the medication is really up to them. But let's say somebody had a sleeve, and I have a patient who had a sleeve, and they're done seeing their surgeon, and we're wondering okay, where is this person at the stage of where I would think about starting a medication for them? So for me, I'm really going to wait to see where their BMI ends up after their procedure. And that could take 1 year, 18 months. It could take 2 years. But for me, the most interesting thing after the surgery is, okay, where is their new normal that the surgery is getting them to? Because this patient may not even need a medication. And wouldn't that be great if they could just have the surgery and not need a medication? That's a win, right? That's one more medication that this patient doesn't need. So I really want to make sure that I know exactly how far the surgery is going to take them in terms of weight loss before I would start to think about adding a medication on top of that. And just for reference, bariatric procedures, patients can lose between, approximately 30 to 40% of their total body weight, and which is an incredible amount. So, of course, I want to make sure that they're getting the maximum effect from that before I would add something else, just so I'm not muddying the waters, because again, they just might not need it. The only time I might think about starting it sooner, and again, this is after somebody has left the the care of the bariatric surgeon. The only time I might think about starting it earlier is if somebody really had it an out of control eating issue that might maybe was coming back, or very impulsive eating that was really disrupting the effect that the surgery was having, or really interfering with the progress that they were making. That's an area where I definitely would consider starting it earlier. But to be honest, when people have bariatric surgery, it's really worth seeing how far they're going to get on that surgery on its own, because there's so many lifestyle things that are changing. People are learning how to eat in a totally different way. They're learning how to plan their day in a totally different way. It just totally reshapes their life in a good way. And so I really want them to get the maximum benefit of that. And again, they just might not need a medication, and that would be great if they didn't. And then if we figure out that, afterwards we really think that they do, it's an option. That's just walking you through my clinical reasoning and how I would think about that. Next question. I've been on the same weight for 3 months on Mounjaro 15 milligrams. My doctor said, just take a break for 2 months and restart on 5. I'm not sure how I feel about that. I was 1 pound away from my goal. I've lost 49 pounds. Okay, this is a great comment because, and again, this is not personal medical advice, but if I had a patient who, was a pound away from their goal and they were on the highest dose of Mounjaro, I'm just going to keep them there. I'm not really tinkering around. I don't really believe in this sort of cycling thing. We don't really have any evidence for that. I know some people are population of one doing their own studies on themselves, but I don't. So far the limited data that we have does not show that people develop a tolerance, and then it does show that even after people have been on the medication for years, they can even lose a little bit more. So for me, if I have a patient and they're at their goal weight or very, very close, I'm really not going to change their tirzepatide or their semaglutide. And if they're not quite where they want to be at, that's where I'm going to think about, okay, what's the next thing? Are we going to change a lifestyle action that we want to put into place? Are we going to maybe add an oral medication? That's the next place I'm going to go. I'm not going to be cycling these medications and futzing around with that a lot. Next question. You mentioned diabetes medications that react with weight loss medications. What medications are those? Basically what I mean is pretty much any medication that people use for the control of diabetes that are not GLP-1 medications. So, the reason that you have to be careful is that you don't want to, this is more of an issue for people who have diabetes and people who don't, but one of the risks of any diabetes medication is the risk of hypoglycemia or low blood sugar. Now, obviously that is the goal of these medications, but you always want to make sure that you're not overshooting the mark. And then, of course, if you have two medications for diabetes, then you have a greater potential for lower blood sugar. And of course, if you have diabetes, this is more of a risk because one of the main issue with diabetes is that your pancreas is just not working as well. Basically, that would be something like if somebody was on Mounjaro and they were also on something like metformin or glipizide or pioglitazone or sitagliptin. Yeah, there are so many out there. But basically, if I have a patient who's already on a medication for diabetes, whether it's being used because they have diabetes or it's being used off-label for something else, I'm always going to be a little bit more careful in terms of making them aware of the risk of hypoglycemia if we decide to start a GLP-1 medication. And of course, the risk is definitely higher for the patients who do have diabetes. That's going to do it for today. Thank you so much for watching. If you have a question afterwards, you can definitely leave it on this video or on another video. If you want to work with me directly, I will leave all that info down below. Go ahead and subscribe to my channel if you're not subscribed already. It's the place for medically based answers to your weight questions. Thank you so much for watching, and please be well.